Our body is quietly becoming a data stream. Not long ago, health information was something collected only during hospital visit. A nurse check your blood pressure, a doctor listen to your heart rate, and the rest of the story remain inside your body. Today, that model is changing quickly. Wearable technology, small devices worn on the wrist, finger, chest, or even inside clothing, is turning the human body into a constant source of health data. What once required a clinic visit can now be monitored every minute of the day. Devices like the Apple Watch, Fitbit Charge, and Oura Ring track heart rate, sleep patterns, blood oxygen level, and physical activity. Some can even detect irregular heart rates or warn users about possible health risks before symptoms appear. In simple terms, the body has become a screen, a place where biological signals are constantly recorded, analyzed, and displayed. The rise of wearables reflect a broader shift in healthcare. Instead of reacting to illness after it appears, technology is pushing medicine toward prevention. Continuous monitoring allows people to see patterns that were once invisible. A spike in heart rate during sleep, a drop in oxygen level, or a steady decline in daily movement can all signal early health changes. This shift is being powered by improvement in sensors, battery life, and artificial intelligence. Modern wearable sensors are small enough to sit inside watches or ring, but sensitive enough to capture detailed biological signals. Software then translates that raw data into simple insights: how well you slept, whether your stress levels are rising, or if your heart rhythm looks unusual. Global adoption is rising fast. Millions of people now use wearables as part of their daily life, not just fitness enthusiasts. Insurance companies, healthcare providers, and researchers are also beginning to use wearable data to study long-term health trends. Some hospitals even monitor patients remotely through wearable devices, allowing doctors to track recovery without requiring constant hospital visits. The impact on individuals can be powerful. Many people say wearables have changed how they think about their health. Saying daily step count encourages movements. Sleep tracking highlights how lifestyle habits affect rest. Heart rate alerts sometimes push users to seek medical help earlier than they do otherwise. But the technology also raises important questions. One concern is accuracy. Wearables are improving rapidly, but they are not medical grade devices in every situation. False alarm can create anxiety, while missed signals could give a false sense of security. Doctors often emphasize that wearable data should support medical care, not replace professional diagnosis. Privacy is another growing issue. Wearables collect deeply personal biological information, data about sleep, heart rhythm, stress level, and physical movements. Technology companies storing this information hold a detailed map of users' health and daily routines. As the wearable industry grows, debate about who owns this data and how it can be used are becoming more urgent. In countries like Nigeria, wearable adoption is still developing, largely limited by cost and awareness. Yes, smartphones are widespread, and as devices become cheaper, wearable health tracking could expand quickly. In places where access to regular care is uneven, continuous monitoring might eventually offer new ways to detect illness earlier. The promise of wearables is simple but powerful, turning everyday life into a health checkup. Your pulse, your sleep, your stress level, all quietly recorded, analyzed, and displayed in real time. As technology moves closer to the human body, a deeper question begins to emerge. If our health can be constantly measured, predicted, and interpreted by algorithms, will we gain greater control over our well-being or slowly surrender our understanding of the body to the machines interpreting it? Leave your thoughts in the comment section. This is Insight from Ask Nigeria, brought to you by Small Lad Meji. Follow for more.